Over the last week, our correspondent was at the Autamaimasa Foundation, where they are a women advocacy and human rights group, and they had a desk review dissemination meeting on understanding the barriers and practices that limit access to sexual reproductive health and the rights service amongst women who use drugs in Nigeria, highlighting gaps in harm reduction service for women who use drugs. We have a video. Take it away.
As we engage on these issues surrounding barriers that limit healthcare practice among women who use drugs, let us also remember that it is our shared responsibility to ensure that women's rights are upheld. We must make sure women are not left behind and they are also empowered to make informed choice about their health and bodies. I wish us all a fruitful celebration and happy International Women's Day.
My name is Rita Musa, and I am the team leader of Autamaimasa Health Foundation. Autamaimasa Health Foundation is a women-led and focused organization. We work with women in diversities, women in minority groups, and their children. We focus on key population issues. We work with women who use drugs, women in different minority groups. Our efforts are around advocacy. We try to enhance or loud the voices of women, because a lot of times women are not listened to, they are not heard. So we make an intentional effort to enhance the visibility around women and every issue that surrounds them.
So the documents we are looking at today, going by the topic, and to help us understand some of the barriers and practices that limit access to sexual reproductive health services among women who use drugs. We may focus on women who use drugs. It also affects women in general, but we zeroed in on this population. It's a 31-page document going by the manuscript. I know they have done a lot of restriction outside.
I bring you greetings from Mr. Nidi Akban, our national chairperson. I'm excited because our Autamaimasa Health Foundation is part and parcel of the network run, and we're here to show our support as usual, and also to encourage each and every one of you to actively participate in the program, so that at the end of the day, we will have cause to say, okay, there's something we have achieved, and there's something we are working towards helping women who use drugs.
Healthy Life Advancement Promotion Initiative is also a community-led organization who is providing services for people who use drugs. And this morning we're here to learn from the desk review and to see how we can make impact, to see how we bring a better life for the people for women who use drugs. Thank you.
On behalf of the coordinator of Kaduna State Harm Reduction Consultation Committee, we are sending our good message to you. We pray that as we come here, for you to have a peaceful and positive deliberation within ourselves, and to have a strong, make a strong decision that will impact the life of women, most especially women who use drugs in the state at large. So once again, we say thank you very much.
Yeah, good afternoon. My name is Inyang Philip from Autamaimasa. I'm the programs director. We are here today to commemorate the International Women's Day by disseminating our DEX review on access to health care for women who use drugs in Nigeria. This DEX review was done in Abuja and Kaduna. The process of the DEX review just basically involved gathering all the information about access to health for women who use drugs, what prevents their access, whether legal, social, or economical.
Autamaimasa Health Foundation is a women-led and focused organization that works with women in different minority groups, women in vulnerable groups, women and their children. We are an advocacy organization that to do our best to, through our advocacy, to enhance the voices of women and children in different communities. Today, being the International Women's Day, we are here celebrating with every woman around the world, and as well, We are here to disseminate a DEX review that was conducted by Autamaimasa Health Foundation on the barriers to sexual reproductive health and rights services faced by women who use drugs while accessing health services. The DEX review focuses on all the challenges women face in their communities when accessing health services, harm reduction services, and some of the cultural, religious, stigma around services. The DEX review captures a lot of stories, passionate stories, experiences of women in the community. We picked up a lot of um, people's experiences, and here we are all together to disseminate and tell the stories, and in hopes that the DEX review will be used in future advocacy for policy reforms, policy reviews, for programs for implementers around the world to make a change that is deserving, and also to address and design or tailor projects, programs that would fit into the needs of the women who use drugs in Nigeria.